Welcome to the first of 5 briefings on DTM and partners cooperation. This first briefing focuses on what DTM is and how DTM location assessment can be useful for partners. This briefing will focus on 4 main topics. It will explain the 4 DTM components. It will talk about strengths and limitations of DTM location assessment. It will illustrate how partners can use DTM data and products, and where to find DTM data and further information on DTM online. DTM stands for Displacement Tracking Matrix. It started in Iraq in 2004, and since then it has expanded to cover more than 68 countries. The map you have in front of you illustrates where DTM has been or still is active. The implementation contexts include conflicts, natural disasters, and complex emergencies. It has been implemented from small-scale and short-term crises to large-scale and protracted displacement and migration crises. DTM is composed by a number of approaches and tools and has 4 main components that are illustrated in this slide: mobility tracking, flow monitoring, surveys, and registration. The top 2 in your slide, mobility tracking and flow monitoring, deal with groups and locations, while the bottom 2, registrations and surveys, deal with households and individuals. Mobility tracking, top left corner of your screen, is made up of 4 subcomponents: baseline area assessment, sub-area assessment, location assessment, and emergency event tracking. Baseline area and baseline sub-area assessments collect information at higher administrative levels. Location assessment collects information at location level. Emergency event tracking informs the humanitarian community about sudden large movements of population. The second component, flow monitoring, top right corner of your screen, tracks movement of population while they're still moving. It's carried out at flow monitoring points that can be on borders or internal to a country. It has 2 subcomponents: baseline assessment and flow monitoring registry. Continuing clockwise to the bottom right corner of your screen, surveys gather specific information using a sample of population of interest. As said before, they look at household or individual level. Examples of surveys could be return intention surveys, community perception surveys, displacement solution surveys, and flow monitoring surveys. The last component is registration, bottom left corner of your screen. Registration is conducted for beneficiary selection, vulnerability targeting, and programming. The subcomponents of registration are rapid emergency registration, verification for registration, biometric registration. Registration is mostly carried out for IDPs contexts. Not all DTM components are always rolled out in every country, and that's important to remember. As DTM is implemented according to need, different components may or may not be implemented in different countries. Let's look specifically now at location assessment. Location assessment is a subcomponent of mobility tracking. It is implemented during initial displacement as well as during protracted displacement. It is implemented at regular interval of time, meaning that it can be used as a monitoring system to look at changes over time. It is implemented through observation and key informants at community level, and both key informants and enumerators are not technical experts in any of the sectors. It is implemented at location level, and location can be IDP sites, camps, villages, neighborhoods, and so on. How is DTM location assessment implemented? Well, as said, it is implemented at regular intervals and can monitor change over time in the same locations. It collects intersectoral data, example, population, location, geographical information, as well as some sector-specific data. It is carried out mostly through key informant interviews and observation. It does not interview samples of individuals or households, and it is carried out at community level. It is not carried out at facility level. Does not interview sectoral specialists, and enumerators are not sectoral specialists themselves. Information is triangulated with more key informants per location. Let's now consider underlying factors and DTM multi-sectoral location assessment. Underlying factors are the reasons why population cannot meet their basic needs. The basic needs assessment guidance identifies 5 main categories of underlying factors: availability, access, quality, use, and awareness. This means that people are in need for lack of either availability of goods and services, or access to goods and services, or quality of goods and services, or awareness or use of goods and services. Now, issues related to awareness and use require household-based assessment approaches, while assessing quality usually must be done by subject matter experts. For example, when GVV or protection experts map existing services, evaluating their quality. As DTM multi-sectoral location assessments use primarily interviews with non-sectoral experts done by enumerators who are themselves not subject matter experts. It will be able to provide information on availability of goods and services and some aspects of access that are more objectively measurable. For example, distance of services and distribution sites. So DTM MSLA will not, however, provide information on quality or awareness or use of goods and services. Let's look at the strengths and limitations of DTM location assessment. Let's start from a few limitations. DTM location assessment cannot ask questions that require a specific technical sectoral knowledge. This is because enumerators and also key informants are not sectoral experts. They're not medical professionals. They're not WASH experts. They're not protection experts. It cannot provide statistically representative information, again, because of the method of data collection used. It cannot replace sectoral, in-depth assessments or monitoring tools. It is not an exercise that will replace in any way a sector or a cluster assessment or monitoring exercise. And it is not program monitoring. DTM location assessment is not used as program monitoring to monitor results or impact of IOM or any other organization's projects and programs. Let's look at the strengths. DTM location assessment often has a very large territorial reach within the country. It covers to the lowest administrative level a very large part of the country. It is implemented in a very large number of crises, so it's very likely that you will find a DTM exercise in your country. And it is flexible, and it can be adjusted according to the needs of humanitarian actors. That is because it's aimed at providing useful data for response. In addition, data are shared quickly. Most data are shared publicly, some through data sharing agreements, because they are sensitive data that could put population or staff at harm's way. Data for urgent action also can be shared in real time with specific respondents for specific action. The global experts that include global clusters and DTM have agreed on a list of recommended questions that have been included in the location assessment bank of questions. And that means that the partners will very likely find information that is useful for their response, as clusters, sectors, area of responsibilities, and experts in other sectors have worked in identifying with the TM the best information that DTM can provide in their field to their counterparts. How do partners use DTM location and assessment data? They use DTM estimates of population and groups at location and national level for planning, advocacy, and for operations. Partners use DTM geo-coordinates of locations hosting IDPs for operational decision-making. They use results of DTM location assessment to monitor change over time by location, region, or at national level. This is possible because the DTM location assessment is conducted at regular time intervals. Partners use this information for planning and operational response. Partners use DTM data also to monitor access to services in locations on an ongoing basis. And they use DTM data to spot sectoral red flags. Those are alerts that partners then can follow up on. Partners use DTM data also to prioritize location for their in-depth assessments and response. If you want to know more about DTM, you can download from the DTM and Partners Toolkit that is online a two-pager called DTM Frequently Asked Questions. It answers the main questions about DTM, what DTM is, and what it cannot and can do for partners. There's also a longer document, a methodological framework used in DTM operations for quantifying displacement and mobility. It describes the DTM components in details and their methodology. You will find this also in the DTM and Partners Toolkit or at the link that is in the slide in front of you. It is very important to remember where you can find DTM reports and data. DTM public datasets and reports are online and they are available at the displacement.iom.int. This is a new user-friendly website that DTM has developed and where you can find datasets, reports, and visualization of data for all the countries where DTM is currently working and has been working. For questions and support, you're very welcome to approach your DTM coordinator in the country where you're working. If you don't know their contact details, you can write to dtmsupport@iom.int, and you can also ask other questions at the same email address and somebody will get back to you with an answer. We're now at the end of the first segment of 5 briefings on DTM and partners cooperation. We identified jointly with partners and DTM common reasons for partial use of DTM data, why DTM data are not used as much as they potentially could be by partners. And then we jointly with partners and DTM worked on solutions that can be implemented by both DTM and partners. The next segment will introduce solutions to the challenges and explain how DTM and partners can better work together to obtain useful and usable data. The tools and the approach for these solutions are included in the DTM and Partners Toolkit, which is a repository of tools and documents, very brief and user-friendly, that can be found online at the link that you have on the slide in front of you. Thank you for listening.